You know, when we get hurt on the outside, the solution is pretty simple, right? A bandage, maybe some stitches. But have you ever stopped to think about what happens when the body gets injured on the inside? It can't just slap a band-aid on an organ. Today, we're diving into one of the body's most incredible and kind of dramatic responses to internal damage, how it builds something called a pancreatic pseudocyst. So let's ask that big question. What really happens when a vital organ, like the pancreas, takes a serious hit? It's not just a simple healing process. No, it's a fascinating story of crisis management, of containment, and of some pretty amazing biological engineering. It's like the body becomes both a first responder and a construction crew, all at once. All right, so here's our game plan. We're going to follow this whole story from start to finish. We'll kick things off with the initial trigger. Then we'll see how the body's first responders show up on the scene. We'll watch the 4-week-long construction of a containment wall, and then we'll get a good look at the final structure. And finally, we'll talk about why understanding all this is so incredibly important. Okay, so first things first. It all begins with a trigger, and that trigger is a major injury to the pancreas. Now you gotta remember, the pancreas is a powerhouse. It makes all these potent enzymes that are designed to digest our food. But when it gets damaged, those powerful enzymes can start to leak out, and they can begin digesting the body itself. And that, right there, is where all the trouble starts. So what are the usual culprits here? Well, the most common one by far is a bad case of acute pancreatitis, which itself is often brought on by things like gallstones or alcohol abuse. But it could also be straight-up physical trauma, like a really forceful blow to the abdomen, or even complications from a recent surgery. Basically, anything that can seriously damage the pancreatic tissue and its ducts can set this entire dramatic process in motion. So, right after the injury happens, the body's first reaction isn't to build some kind of wall. It's much more, well, chaotic. The damaged pancreas just starts leaking this fluid that's packed with all those powerful digestive enzymes, and it pools in the surrounding area. And this initial leak, it has a name, an acute peripancreatic fluid collection, or APFC for short. But the key thing to notice here is that it's just a raw, uncontained pool of fluid. There's no wall, no capsule, nothing like that yet. It's just there, kind of held in place by the body's existing internal structures. This is the messy, immediate fallout from the crisis. And here's the thing. Most of the time, the body is amazing and it just handles this. The immune system comes in, cleans up the mess, the fluid gets reabsorbed, and everything goes back to normal. Crisis averted, case closed. But what if it's not? What happens when the damage is just too severe, or the leak is too persistent, and the body's cleanup crew gets totally overwhelmed? Well, that's the turning point. That's when the body's whole strategy shifts, from simple absorption to full-on containment. And this brings us to what's called the maturation phase. After that initial crisis, the body basically realizes, okay, this problem isn't going away on its own. So it starts this incredible construction project. It begins to build a wall around all that toxic fluid to seal it off and protect the rest of the body. Now, this is not a quick fix. We're talking about a construction project that takes a month or even longer. It all starts with the injury and that initial fluid collection, the APFC. But when that doesn't go away, the body starts building. Over the next 4 weeks or so, an inflammatory capsule starts to form, and it matures into this thick, fibrous wall that completely seals off the fluid. And once that wall is complete, it has officially become a pseudocyst. And this is just a brilliant way to think about it. A pseudocyst is essentially a quarantine zone. It's the body's last-ditch effort. It's building an internal wall of scar tissue to contain a problem it just can't get rid of. It's a really pragmatic, if not perfect, solution. So now that this structure is fully built, let's zoom in and take a closer look at what it's actually made of. What is the anatomy of this biological containment unit? Well, the formal definition actually tells us a ton. It's a collection of fluid that's rich in amylase. That's one of those key pancreatic enzymes we talked about. And it's also surrounded by that tough wall of fibrous or granulation tissue. Now, here's the really crucial part, the name. It's called a pseudocyst, and it gets that name because unlike a true cyst, its wall isn't made of a special layer of cells called epithelial cells. Nope, it's basically made of scar tissue. So, let's just break down its defining features. You've got that scar tissue wall, you've got that enzyme-rich fluid locked inside, and, get this, in more than half of all cases, there's a direct connection, a channel, back to the pancreatic duct, which is often the source of the leak in the first place. And these things are usually found just outside the pancreas, which makes sense since that's where the fluid originally pooled. Now, you might be thinking, okay, this is a really cool biological process, but why is it so important for doctors to understand this inside and out? Well, it turns out that telling a pseudocyst apart from something much, much more serious can be a huge diagnostic challenge. And here is why this matters so much. On a CT scan or an MRI, a pseudocyst can look eerily similar to a cystic tumor of the pancreas, and some of those tumors can be cancerous. So making the right call between a benign inflammatory collection and a potentially malignant tumor is, as you can imagine, absolutely critical for the patient. So how in the world do doctors tell them apart? They play detective and look for clues. First, they look at the patient's story. If someone just had a bad bout of pancreatitis, that points strongly towards a pseudocyst. But the real smoking gun is in the fluid itself. They can take a sample and test it for a tumor marker called CEA. Think of CEA as a chemical that's often really high when certain tumors are around. Fluid from a pseudocyst will have very low CEA levels and be full of inflammatory cells. A cystic tumor, on the other hand, often has sky-high CEA levels and might even have cancerous cells. It's this analysis that's so critical for getting the diagnosis right. So at the end of the day, when you think of a pancreatic pseudocyst, don't just see it as a medical complication. Think of it as this incredible biological story. A story of the body recognizing an internal wound it can't fix, and then launching this complex, month-long construction project to wall it off and protect itself from further harm. It's pretty amazing. And all of this leaves us with a truly profound question, doesn't it? At what point and how does the body know when to give up on just healing and cleaning up? What's the molecular switch that gets flipped that says, all right, plan A isn't working, it's time to switch to plan B and build a wall? That exact decision point, somewhere between absorption and encapsulation, is still one of the most fascinating mysteries of our own biology.